Introduce myself that this is Meenal Salve. I have done my CPC in 2016 and I have done my MSc as well. Then I have did diploma in clinical research. So I have total 10 years of experience in medical coding. So I have worked in many organizations. I've started my career with GEPS Healthcare and I have worked for multi-speciality coding. So I know all specialty. So with this, we are good to go. We'll start for our session. Okay. Just give me a second. Just 2 minutes. Huh? Yes. So here we will see what is medical coding. So as I told you, we are going to start with the basic things. Okay. So what happened here in medical coding? So the healthcare provider review your complaint and medical history and makes as an expert assessment of what's going wrong and how we can treat. So, and documents your visit. So this documentation, how the healthcare provider get paid. So I'll explain you in the simple way here in India, how we are dealing with medical problems. Okay. In India, what happened, when we have a fever or cough or anything like that, we are going directly to the doctor. Okay. We are telling doctor that I have cough or I have fever like that. So they are treating you. They will make a note. Okay, these things is happening and they will give you a medicine and you are directly going to pay to doctor. That is the thing we are following over here in India. But in US, they have whole structure. Okay. The payment is conducted by insurance company. It will take care by insurance company. Okay. So that's why they have given like healthcare provider review your complaint. So healthcare provider means doctor. They will review your complaint and medical history. Okay, so everything they will note it down. There will be a software and we are going to note it down everything. And they will make an expert assessment, what is wrong and how we can treat. So what they are doing, providers, they are making documentation of everything. Okay, and they have to submit it to the insurance company, whichever plan patient have to that insurance company, they are submitting that documents. Okay, and after approving that documents, that healthcare or that doctors is gonna get payment. Okay. Hello.
Yes, you can continue.
Okay, so this is how the US people are gonna treat and the doctors are gonna paid. Okay, so what we are doing here? So what we were doing, we are getting that documentation reports and we are transferring that documentation. You can say a medical record. We are gonna translate into a standardized code. Okay, so this is the basic thing about medical coding. Okay, medical records we are getting, that means documentation we are getting. In that documentation, there will be a history of a patient, what's wrong, what is going on with that patient, and how we have treated that patient. All documentation will be there. We are getting that documentation and we are going to translate that documentation into standardized code. Okay, so I hope you understand what is the basic of medical coding. Anyone has any doubt? Okay, so we'll move further. Okay, so medical coders translate documentation into standardized code. Okay. So what does standardized code means? What it contains? It contains patient diagnosis. It contains medical necessity for the treatment, services, supplies the patient received, treatments, services provided by the to the patient are any unusual circumstances or medical conditions that affected those treatments and these services. Okay, so these are the things it will be there in that documentation. So we'll see further how many standards code we are getting and how we can code that. So there are different types of standard code, standardized code you can say. There will be a CPT. CPT is a current procedural terminology. As you can say, procedural means there will be a procedure. What procedure means provider has done or doctor has done. Then ICD. There will be a ICD like International Classification of Disease. So this ICD is related to the diagnosis. Whatever doctor has diagnosed, that is, you have to give ICD code for that particular scenario. Then it will be HCPC. HCPC will be healthcare common procedural coding system. It will be a mix of some alphanumerical terms or numerical terms like that. So as I told you, diagnosis will be ICD and procedure code will be CPT or HCPC. So I will tell you an example. Suppose patient is going to doctor and he's saying that I have chest pain. Okay, in that chest pain, what doctor will gonna do in that case? He will just see, he will note it down everything. Okay, and he sent that patient to take an X-ray. Okay, chest X-ray. So for chest X-ray, we are gonna give a CPT code. That means that procedure has taken place, so that will be our procedure. For that procedure, we are going to give a CPT code. So we are going to give CPT code of chest X-ray. And what are the ICD? What are the diseases they found? So here we can see patient is coming with the chest pain. So if there is no confirmed diagnosis found, then we can go for the chest pain. We can give the ICD for a chest pain. Okay, so these are the terms how we are using that I just want to tell you. That's why I gave that example. And HCPC also there will be alpha numerical coding system in that both numbers and alphabets will be there. So there are many codes like that. So we are gonna see that as well. So I hope you understand what are the standardized code, how means how many codes we are gonna use in medical coding. Then we are gonna see what is CPT. Okay, so it is developed by American Medical Associated yearly. Okay, so CPT is getting updated yearly. So there will be in October, I guess, they are updating that CPT course. So it will be a slight updation. Okay. Sometimes they added some codes, sometimes they deleted that code. So like that, there will be updation in the CPT book. So in CPT books, you can say codes and alphabet index will be there. In later trading session, we are gonna see how we can go through that CPT book, how we can read that CPT book. So everything we are gonna cover. So this is CPT book. So codes will be there, alphabetical index will be there, then appendix will be there. So that is modifiers. So these are the sections of the CPT book. Means these are the you can say many partition of a CPT book: codes, alphabetical index, and modifiers. Okay. So how many CPTs will be there? That is also main part. So in CPT book, there will be a ENM, that is evaluation and management. ENM is what? A regular office visit. Okay. If patient is coming with some complaint and we are evaluating that and we are managing that complaint. Okay. We are analyzing. That means we are evaluating that complaint and we are managing that. So that is comes under ENM, evaluation and management. Later there will be anesthesia. If any surgery is happening and we are providing anesthesia, for that we have separate codes. That is, it comes under anesthesia section. Later there will be a surgery codes. Surgery, so all kind of surgery will be there. Every surgery will cover in this section. So there will be a surgery code. Later there will be a radiological. Okay, if you are doing some X-ray, if you are conducting some MRI, CPT, or ultrasound, so all these will cover into a radiology. There will be a pathology or laboratory. So if you are conducting any biopsies, any stains we are using, any test we are going to follow, any frozen will be there. There are many things in laboratory or pathologies. So will be there. Gonna take all those things in section pathology. Later there will be a medicine section. In medicine section there will be a drug codes. Okay. So this is how the section of CPT will be there. There are total this many sections. So I hope everyone understood about CPT. Any question? Okay, fine. So we'll move further. So next will be ICD. As we said that ICD is for diagnosis. We took one example, right, for ICD. That is if you are going with that for the doctor and we are telling we have fever like that. So they will provide a diagnosis. So this is code for a diagnosis. So there will be 3 to 7 digits. Okay. So first digit will be alpha, second digit will be numerical, and third and seventh digit will be alpha or numerical. Again, this ICD, it approves by WHO. Okay. And since 2022, ICD is also getting updated twice in a year. So this is the basic information about IC. So we will see further in this picture. You can see there are 7 digits of ICD. Till 7 we are getting. Not always there will be a 7 digit. So here we can see 3 to 7 digit will be there. Sometimes it's 3, sometimes 4, 5, 6. It depends upon how many diseases and how your diseases are. So I am gonna teach you about ICD. So I took the example for 7 digits. Okay. So 7 digits will be there. First 3 digit will be for first characters. Okay. First 3 characters will be disorders and continuity. So here they have taken the ICD for M84.311A. This is for stress factor, right shoulder, and initial encounter. Okay, so we are gonna see this example for analyzation, the structure of ICD. Okay, so first 3 digit will be 3 character will be for what the specificity, or you can say what is the disorder, main disorder. So they will denote that 3 characters. Later, 3 characters will be for etiology, anatomy site, severity, like that. Okay, so here you can see you have given the third character, that is 311, is for stress factor and right shoulder. So this later 3 character will be for all this thing. There will be anatomy side and severity. And seventh character is A. You can say A over here at the end. That is your initial encounter. Means patient is coming for this fracture first time. So there will be a, there will be a S, there will be a D, like that. It will change as per your condition. Okay, so this is basic structure of ICD, and these are the things we are going to study in ICD. So there are books for ICD. We can go through that and we can get concluded towards our diagnosis. Okay, I hope you understood. One have any question? Okay, fine. So there will be many certification for coding. Okay, so basically there are two organizations who provide the certification. There will be AAPC, American Academy of Professional Coders. They are providing CPC, that is Certified Professional Coder, COC, Certified Outpatient Coding, CIC, Certified Inpatient Coding, CRC, it is Certified Risk Adjustment Coder. Okay, so here you can see for the first certification, that is CPC. So CPC will cover all the specialty. Like how we can see there are different specialties have different certification, like COC for outpatient, CIC for inpatient. But in CPC will cover your all certification. You can say these are the small certification and CPC will be the biggest one. Okay. If you have done CPC, so no one will ask you about if you have completed COC, CIC or CRC likewise. Okay. So like that, there is another organization, AHIMA. AHIMA is American Health Information Management Association. In AHIMA, there is one certification that is CCS. So CCS is what? Certified Coding Specialty. In CCS also, there will be inclusion of all other specialty. So if you have completed CCS also, that is fine. But I just want to give you the what you can say the brief about the certification of a coding. Okay, so this many certification we have. So mostly APC is valuable. So CPC is very important. If you want to go through that, any certification, so CPC is a must. Mostly they are accepting CPC everywhere. Okay, so this is certification we got. These many certification is there. Any doubt in that?
Someone asked which one is the best.
Yeah, so CPC is the best. Okay, because it contains everything. You will gonna learn all the things in CPC. So CPC will be the best. There, you can take every specialty, like there will be outpatient, inpatient, and there will be anesthesia, and all the things will be there in CPC. So CPC will be always good.
Ma'am, can CPC is necessary for beginners coders?
See, if you have to start with a good salary and everything, so it will be good. Otherwise, they are not gonna give you that much salary, or later you can do CPC, but my suggestion, if you are doing it initially from the beginning, it will be good for your career because you are getting good opportunities after you have done with the CPC.
Ma'am,
So
can I
mostly, Mhm.
start job and after job can I CPC get certificate?
Yeah, but right now, most of the companies are asking for certified coder.
Ma'am,
So previous.
initially CPC is necessary for job.
Yeah, if you are doing CPC, it will be good for you as well because nowadays many companies are asking for certified coders. They are not willing to take a freshers. Very few companies are there. They are taking freshers and later they are conducting uh, training session and all. But nowadays, no, there are only taking certified coders.
Okay, ma'am. Thank you.
Mhm. Anyone? Okay, we'll move ahead. So, as we discussed, why certification is important. Okay, in medical coding courses are important because they prepare student for a career in coding by providing the skills and knowledge. Okay, so if you are a certified coder, so how we are gonna see that documentation, right? So they will be ensure that insurance of accurate documentation and billing will happen. Okay, so as I told you, why they are taking a certified coder, because they will get an insurance. They will get ensure that documentation and billing is happening accurately. Then translate patient information into universal language. That is your standardized course. So they will get assurance that, okay, if there are certified coders, so they are gonna read the documentation thoroughly and they are gonna give the perfect CPT code or ICD code like. And also it will be advanced in careers. So you are also getting advantage if you are certified coder. Okay. So again, there are many benefits for certification. So you'll get a great pay. Okay, nowadays for freshers, you can say you are getting only 6 to 7 thousand per month, I guess. And if you are certified coder, then obviously it will be around 16 to 17 like that. At the beginning, I'm saying, okay. And as you can go further, your salary will get increase. You can work remotely. If you are certified, then many companies are there who are willing to give you remote work. That is your work from home. They are willing to give you. The starting, they will ask you to come because there are many softwares or everything will be there. So they want you to understand all the scenarios. And later, if you are certified, they will give you work from home as well. Okay. So it's a rewarding career. So again, if you have done CPC, there are again many certifications are there. You can also go through that. There is a certification for trainer and other things will be there. And you can never stop learning. As I told you, medical coding is the field where you have to keep learning about new things. There will be many things that you will learn newly, and while working also, you can learn many things. How you can get through that code, how you can read that medical reports. So everything you can learn. And after doing certification, you can also gonna see the difference, how the beginners are gonna read your medical record and how certified students are gonna read that medical record. So there will be a much more difference between them. Okay. So the in medical coding, first reading as a medical record is very much important. So you will learn everything in this certification course. So that's why it's important. So there will be a more career opportunities. If you are certified, you can go through ENM, you can go to radiology, you can go to pathology, anesthesia. There are many vacancies over there if you are certified. Okay. And you can improve your social interaction. As you are certified, you can go through the client call, you can discuss with your auditors, you can discuss with your coders, managers, everyone. So it will be good to social interaction. And it is not like you have to spend 1 year for completing the certification and everything. It's a short and flexible timing. So you can do that in very easy way. So you don't have to spend much time for that certification. Okay. So these are the benefits for the certification. Okay. We'll see. The next is, what is career growth for medical coding in India? In medical coding industry in India is growing rapidly with a high demand of certified medical coder. Okay. So that's why I told you, right? If you are certified, there are many more chances that company we are gonna take you for a job, because they are only willing to take certified coders nowadays. So there is more demand for certified coder. So how we can see there are many companies are growing nowadays, mostly in South and nowadays in Maharashtra also. And Noida, Chandigarh, everywhere there are a medical coder industry is growing. So they are, if you are specialized in particular specification, like if you are you can say your thorough or your expertise in ENM or your expertise in surgery. So for that, they are gonna give you a salary. If it is for radiology and how many years you have spent with that specialty. So accordingly, your salary will get increased day by day. Okay. So if you learn, suppose radiology now, and you want to learn other specialties like ENM surgery. So you can learn that meanwhile and you will get good opportunities. So my concept is you have to learn all specialties, okay, for career growth in India. So by the time being, you can learn that. But if you are certified, you can start with any specialization and you can get experience in that and you can go further. So likewise, you will get your salary increment, you will get good opportunities, and it's also a career advancement. Okay. So you'll get a good growth in a career. And also you'll get a quick start if you are a certified medical coder. Okay, any doubt? Anyone has any doubt?
Hello, ma'am.
Yeah.
Ma'am, can AI replace the medical coding?
No, because what happened, already if we are doing coding, right? In that coding, already we are getting the coded reports. Okay, so CPT will be there, ICD will be there. We just have to look into that report. We have to update whether that given CPT is correct or given ICD is correct or not. So I don't think AI will replace for this medical coding. Anyone? Okay. So we can see the salary structure for medical coder. Okay. I hope this is a very important structure. We can analyze that. So you can see the first level over here. So there is a entry level of medical coder. So whatever the amount they have given, like 2 lakhs to 3 lakhs, it is be for per annum. This is for beginners. Okay. If you are a fresher, then you are getting this much salary. And if you are certified, obviously you will get 4 to 5 lakhs per annum. Okay. Later you'll be the senior coder with some expertise in some specialization. Again, there are many specialities like a surgery, denial, and IPDRG. So in this specialization, their salary is much more than 6 lakhs, I would say. Okay, for senior medical coder, minimum they have given that is 6 lakhs per annum. If you go further into many specialization, that 6 lakhs can turn into 10 lakhs as well. Okay, so that's why I told you that it's a learning platform. You can learn many things in here. And if you are going for manager, supervisor level, it will be 8 to 10 lakhs like that. And if you are a director, it will be more than 20. It is the till 20 lakhs you can earn per annum. If you are any director of the healthcare academy, or you can say you are a director of any particular company, so you can earn up to this much. So this is the basic salary structure for medical coding, how you can grow over here. You can see the chart. Okay. So you can see how the coding market is increasing. Saying 2023, it is 16.72 billion. Later it goes into 18. So it will grow. How much? This is 26.04 billions in 2028. This is the growth chart for the medical coding. Okay. So now we have seen what are the basic concept of medical coding, how many certification will be there, and if there is growth or not in the coding. So we can see it's a quick growth and you can learn quickly in the medical coding. So there are many chances that you can grow in this field. Okay. So now we are gonna see what are the things involved in the CPC. Okay. So I'm gonna take only for CPC because we are conducting the seminar for the CPC. Okay. So there will be a identification, identify the purpose of CPT, ICD, and HCPC level 2 codes from books. So we are gonna learn all the CPT, ICD, and HCPCs. We are gonna understand and apply the officials of ICD-10 in coding guidelines. We are going to apply coding conventions when assigning diagnosis and procedure codes. Then identify the information in the appendices of the CPT and code book. Explain the determination of the levels of E&M service. Code a wide variety of patient services using CPT, ICD, HCPC codes. List the major features of HCPC level 2 codes. Provide the practical application of coding operative reports and evaluation services. So these are the course objects. So we are going to learn all those things in the CPC. Okay. So these are the again the content we can say. So what we are going to do in the CPC course. So we are going to see the business of medicine. First and most, we are going to review the anatomy. Okay. We are overviewing the ICD-10, applying ICD-10 guidelines, and accurate ICD-10 coding. So I'm going to tell you the difference between them. Overview of ICD-10 is what? So what is the diagnosis, the main diagnosis? Suppose there is a fracture of a leg. You can get a report. If you get a report like there is a fracture of leg on right leg, okay? So you know the fracture. So you are going to overview that ICD-10. How you can apply that ICD-10 is you are going to see that the guideline, okay? So this is how you are going to apply the ICD-10. And for accuracy, you are going to say, go through the um if it is fracture, then what type of fracture it is, on which leg it is. So that will be the accuracy. And if it is initial or subsequent, all those things will calculate in the accurate ICD-10. So in ICD-10, we are going to learn how we can get to the accurate ICD-10. So there will be a index, there will be a table form. So accordingly, we have to go through and you can get the accurate ICD-10 over there. Then there will be an introduction of CPT, HCPC level 2 and modifiers. Okay. And later we are going to see integumentary system. Okay. In that things we are going to study hairs, nails, skin. What are the related disease or CPT will be there? We are going to see that in the system. Later it is musculoskeletal system. In the musculoskeletal, again, we are going to analyze how we can go through that CPT, ICDs, and sometimes modifiers. Then there will be a respiratory system, cardiovascular system, hemic and lymphatic system. Okay, in that you can see mediastinum, then diaphragm, then there will be a digestive system, Urinary System, Male Genital System, Female Reproductive System, Maternity Care and Delivery, Endocrine System, then Nervous System, special senses like Ocular, Auditory, Anesthesia, Radiology, Pathology, Evaluation Management Service, that is ENM, Medicine. And after reviewing all the systems, ICD, CPT, and all the guidelines, we are finally getting to the final exam. Okay, so these are the contents for the CPC. So everyone understood? Anyone has any doubt in this?
Yes, ma'am.
Yeah, please. You can ask your doubt.
Ma'am,
Mhm.
are there any chances that AI will overtake all the medical coding jobs in coming years?
Is there chances? What I am not able to hear you properly.
Are there any chances that AI will overtake all the medical coding jobs in future?
No. As I told you, there are already coded reported reports we are getting. So again, we have to work on that reports manually. So there will be no chance that AR will take place on these things.
Okay, ma'am. Thank you.
Mhm.
Hello, ma'am.
Yes.
Ma'am, my one question is, my what skills I have admire myself in during my curriculum, and I my college have don't placement sales. Then
Mm.
how I go through the placement activities or internship in medical coding.
Okay. So after giving the certification, right? If you are certified coder, then there will be many opportunities, and here also we are providing the placement for a medical coding. Okay. Any other question you have? Any other doubt? Okay, so we'll move further. There are many methods that you can evaluate. Okay, so the instruction methods used include like reading the assignment, practice exercise will be there. There will be other assignment also. Audio video lectures will be there. And we can see the chapters review exam will be there. Suppose we have completed the chapter for musculoskeletal. Okay. So after that chapter, we are going to conduct the exam. We are going to conduct the test. So you can go through that chapters very easily. And if you have any doubt in that chapter, you can resolve that chapter there itself. Okay. And so I can give you the course length. So it will be 4 months of period and less than that. Enroll date begins at the date of purchase. So you will get 4 months to complete your CPC exam. Okay. And successful courses of completion will be 70% or higher. So you have to score 70% and higher in that exam. This is how you can complete your exam. So this is the basic structures of CPC. So with this, I think I have given the many examples or many basic things about CPC, how you can analyze and how you can do further. So with this, we have completed our session. So if you have any type of questions, anything you want to discuss, you can ask me. Okay. Any normal question also you can ask. Anything.
Ma'am,
Hmm.
how CPC exam is conducted? I mean, is it open book?
Yeah, it will be open book test. So you have to take your CPT book, ICT books, and HCPC books along with you. And later they will provide. There will be a exam. So you have to search your ICD or CPT course accordingly, and you have to work. It will be open book test.
And how much it costs?
How much it?
I mean, cost. What is the cost of CPC exam? I mean,
I think I'm not aware current cost. I think it's dollar. I'm not sure about the accurate amount of CPC. Currently, it is. I think.
As per my knowledge, I think it depends on the attempt. Single.
Yeah, you will get two attempts in a single purchase. So if you failed in one attempt, there will be another attempt as well.
Ma'am,
There is first AAPC registration, and
Yeah.
after that you have to get a coupon of single or two attempt. I think it is around 50,000 for one attempt and like 60 plus for two attempt. It depends on
Yes. Mm-hmm. As per attempt, we can take.
Ma'am,
Yeah.
can we get internship in medical coding, but before without giving CPC exam?
As I told you, many companies are hiring a certified coder. So my suggestion that is if you are certified, you will get a good amount of salary and it is more chances that company will take you for a work. Otherwise, it will be little difficult that if you are fresher. So nowadays, companies are not hiring for freshers mostly.
We will not get internship also.
No. Why you need internship? It will be only for 4 months, and it's like a 4 months. It's maximum duration I can see. But you can complete within a 1 month, 2 months, likewise. But my suggestion, you can take a whole 4 months if you are a fresher, and then you can go for an exam. So it will be good for you. Many companies are conducting for certified coders only.
Okay, ma'am.
Mhm.
So we'll take some few questions
hello,
from.
ma'am.
Yeah, yeah. Please ask.
So, sir, hello,
Yes, yes, can ask.
I am audible.
Yeah, yeah, you are
Ma'am,
audible.
ma'am, I am pursuing from pharmacology. Then ma'am, I eligible in this course?
Sorry, can you repeat your question?
I am pursuing pharmacology. Am I
Mm-hmm.
eligible in this course?
I don't understand your question. I
Can
just
you
know
ask in
that you
chat?
are, yeah,
Ask it.
yeah.
मैं फार्माकोलॉजी से एम फार्मा कर रहा हूँ एम फार्माकोलॉजी से मैं एलिजिबल हूँ कि नहीं इस कोर्स के लिए मेडिकल कोडिंग के
Yes, yes, yes. See, pharmacy people and graduates from life science are eligible for these courses. Okay, this one is your question, right? यही क्वेश्चन था आपका ना?
यस मैम
Okay, okay.
Ma'am, after the completion of CPC, can I get the job in foreign country?
You can get the job, but you have to be there in foreign country. From here, they are not hiring. So after CPC, also, if you are willing to go there, you have to get an experience, right? Which specialty you have experience like that, you have to gain your experience, and later you can go.
Ma'am, which specialty in medical codal is better, like surgery, medicine?
Um, Currently, the highest specific specialty is IPDRG. Then there will be a surgery or medicoding renal,
Yes.
and later there will be a ENM, anesthesia, likewise. So it's depend upon how much experience you have in that particular specialty. Depends upon that.
Okay.
Mhm.
So Meela ma'am, anything remain to share from PPT?
No, I'm done with that PPT.
Okay, okay.
Yeah.
Okay, so we share one PPT of our academy, okay, sharing the program information about the medical coding. Just kindly go through it and then we continue with the question and answer. Okay, yeah.
Okay.
So, yeah, so our student coordinator Snehal is there and
Mhm.
she's presenting the slides and explaining it as well. Okay, yeah,
Okay.
thank you. Yes, Snehal, you can continue.
Yes, yes. Just give me one.
Yeah.
Hello, good morning everyone. Am I audible to all?
Yes, you're audible.
Okay, so myself Snehal, a student coordinator of Global Pharma Academy. Here I will share our academy information. Okay, so kindly go through it and if you have
Mm-hmm.
any questions you can ask. Okay, so I'm sharing my screen. Just let me know it is visible or not. Am I audible properly? Can anyone please confirm?
Yes, you're audible.
Yes.
Oh, oh. So today's webinar is arranged by the Global Pharma Academy Pune. Okay. Yeah, so Global Pharma Academy Pune, we are Global Pharma Academy, which is ISO and MSME national level institute in pharmaceutical and healthcare sciences, established with a proclaimed objective of becoming a center of excellence to guide students for building their career in the pharma sector. So we offer various certification programs like pharmacovigilance, advanced medical coding, clinical data management, medical writing, retail pharmacy business management, wholesale pharmacy business management, then pharma marketing, then drug regulatory affairs, then basic medical coding, clinical research. So these are the courses we provide here. So here I welcome the founder of Global Pharma Academy, Amit Kumar Mane sir. Education, he completed the pharmacy and MBA. He has 13 plus wholesale international export knowledge in pharma sector. So he is owner of Alan Medical and Distributor since 2013. He is the trainer for retail and wholesale pharmacy business management. He is the host of one YouTube channel and channel name is Things by Amit. Also, we have the family of 1 lakh plus subscriber on our YouTube channel. So to know the all update regarding courses, interview preparation, and subscribe our channel. Okay, so moving to the next slide. Here I welcome the HR of Global Pharma Academy. Her name is Shubhangi and she completed the Bachelor of Pharmacy. She is a HR of our organization having responsibility of job systems, wide knowledge regarding the interviews and soft skill development classes. What happened? Okay. So her contact number is 7499252772. So if you have any query related to the courses, you can connect with her as well. Okay. So Here, this is me, Business Development Executive of Global Pharma Academy. I completed the Bachelor's of Pharmacy, and here I resolve the general queries of Global Pharma Academy students, assist them for the daily assignments, mock interviews, and project work. I am also handling the admission queries as well. So, my contact number 9322341947, and this is my email ID globalpharmas516@gmail.com. So if you have any more questions related to the courses, duration, fees, the courses, you can connect with me anytime through this number or through this email ID. Moving to the next slide. Mission and vision. So with the goal of educating every aspirant who want to work in the pharmaceutical sector, we offer education at most affordable price in India. So our goal is to lead the pharmaceutical training market on a global scale, and India should grow into a country known for the innovation and quality. So we want to be the first global platform where business executives may select the top personnel in the pharmaceutical sector to satisfy the most recent industry demands. So benefits of our courses is like our students are trained and nourished under excellent faculties having 15 plus years of industrial experience as well as academic excellence. And here students are rigorously trained to meet the industry requirements. So apart from the domain knowledge, we provide this during our courses like assignments and tasks, resume preparation, communication skills, presentation skills, mini project, conducting the mock interviews, personal development, provide job assistance, conduct the examinations and doubt clearing sessions also. So moving to the next slide, syllabus. So this is the syllabus that will cover during our 3-month online certification course. And the syllabus is like the business of medicine, review of anatomy, review of ICD-10-CM, applying the ICD-10-CM guidelines, accurate ICD-10-CM coding, then introduction to CPT, HCPCS level 2 and modifiers, then integumentary system, musculoskeletal system, respiratory system, cardiovascular system, then hemic and lymphatic system, mediastinum and diaphragm, then digestive system, urinary system and male genital system, then female reproductive system and maternity care and delivery, then endocrine system and nervous system, then special senses like ocular and auditory, then anesthesia, radiology, then pathology and laboratory, evaluation and management services and medicine. So this is the syllabus we'll cover. So study material provided for the CPC coding courses. We will provide this study material to hard copy like CPC book, question papers, and will provide soft copy material as well like CPT book, ICD-10-CM code book and HCPCS code book. So moving to the next slide, certificate format of our academy, like this is the certification. Once you done the course, you will get this type of certification. So moving to the next slide, how to enroll. So if you want to enroll for this course, pay online, Google Pay, Phone Pay to this number 9423272876. After successful of payment, share payment screenshot with your name, email, location, qualification, WhatsApp number on WhatsApp to this number 9423272876. After that, receive confirmation email, and before one day all students will be added in class group on WhatsApp where all class links and recordings will be shared. So duration of this course. So duration for this course is 3 months, mode online, platform, Zoho, and class date which will start from 12 January 2025. Timing for the classes is evening 4 p.m. to 6 p.m. Classes schedule only on weekends, okay, Saturday and Sunday. And for this course is 20,000 for the first 20 admissions, okay. So moving to the next slide, contact us. So these are the our social handles. We are on Things YouTube. Channel name is Things by Amit. We are on LinkedIn. Name is Global Pharma. We are on Instagram. Name is Global Pharma Academy. So this is our website www.globalpharmaacademy.com. Apart from this, we have also our academy channel. The name is Global Pharma Academy. So to know the all update, you can subscribe this channel. And these are some contact number. Okay, CEO Amit Kumar Mani 9423272876. This is my contact number 9322341947, and this is HR contact number 7499252772. So we are on mobile application as well. Here are the link. This is the Android link. This is iOS link and web link. So you can download the application from Play Store as well. Thank you. So now if you have any questions related to it, you can ask.
Yes, thank you, Snehal, for this presentation. And I hope everyone got this information about our 3-month training program as well in the CPC medical coding. We basically train you for the CPC exam. And we also provide you the skill development sessions like resume interview preparation, soft skill development, and placement assistance as well along with the course. Okay, so this is information, and the course batch will start from the 2nd week of January. Okay, and the fee, if you need to know more information, connect with us. Okay, so this is about the course. Now we continue with the question and answer. So Snehal, kindly ask the question to Minal ma'am. She will answer it. Yeah, from the chat box there are questions, and anyone you can also unmute and ask. Yeah. Thank you.
Okay. Okay.
Hello,
Yes.
ma'am. Offline mode also available for this course or not?
No, right now there is only online mode for this batch.
Okay. How to study about medical coding certification and its structure, how to become certified and its fees. I think this question is already covered, right?
Yes.
Okay. Ma'am, so after some years, do AI will completely overtake medical coding jobs? This also covered, right?
Yes, this we have taken.
Time
Ma'am,
required
what?
for the exam.
Hello,
Excuse me, ma'am. I have a question.
Yes, please ask.
Ma'am, I'm a bioinformatics postgraduate. So, will this course be benefit for me?
You have done life science in that or not?
Yes, ma'am. Life science.
Okay, if you have done life science over there, you can do it.
Okay, ma'am. Thank you.
Yeah.
ma'am, what is the exact fees of CPC exam? I want to know.
What is the exact what?
CPC exam fees.
As we discussed this, right, with Amit sir.
Yeah,
It is
it depends on like attempt. Okay, so it is in the dollar, but in Indian rupees it should be like there is you can get the AAPC subscription first, the membership you can say, and then after you have to enroll for the certification. Okay, the certification is 1 time or 2 time. Okay, and there is 1 year validity once you get this voucher. Okay, you have to get the voucher, and there is details involved in it. And within 1 year, you have to give an exam anytime. Okay, it is completely on your choice, and you can select your nearby location, like their exam center, and you can give it. So the fees you can say in Indian rupees around 50,000, including membership and the fees like certification exam fees. And for the 2-time, it is around 60,000 plus, around 65, not exactly, no, but more than 60 plus is there for 2 times. You got it?
Yes, sir.
Yeah, continue with another questions.
Yes, time required for the exam.
Okay, so minimum you can give the exam within 2 or 3 months. Okay, after completing this course, will be for 4 months. You can go. We have to see how much you have able to take the conduct the mock test and everything. If you scores well in that mock test, you can go for exam.
And the pattern of the exam?
It will be open book test, and there will be MCQ kind of questions will be there, and some question will be in the brief. Will be a medical record kind of a thing, and you have to give the exam. So everything will be a MCQs kind of things.
Okay. Can
Mhm.
you introduce the teachers who will teach that course?
Okay, so I'm only gonna take the course for the CPC. Okay, so I am okay with the three languages like Marathi, English, and Hindi. So you can ask me doubt and we can go through that.
Main branch of medical coding in India means what you want to ask, Ankita? Yes, any more questions, students? You can message or you can directly ask.
Everyone, please ask the question. Everyone, did you understood first of all the session? Any query in the session? Everyone, Aditya, Aishwarya, Ajay, Alfia, Alisha, all of you. Okay, there are a lot of students. So kindly, no, it is eligible to also kindly respond. You got the session today. You understood properly each slide.
Yes, sir.
Okay. Yeah, so definitely there are questions. That is why I joined, and it is like time when like these it is Q&A session. So please ask your queries. Either you can unmute yourself or ask in the chat box. Okay.
Sir, as you said, you provide placement assistant, right?
Yeah. Yes.
After completing your course, can we get placement as a non-certified coder, or we get placed after CPC certification?
Basically, our major aim is that you can crack the CPC exam, and that is why we prepare you for the same. But in case if you are not certified, that you are non-certified, and that case also we are providing opportunities. And like as we are providing job assistance to all students, whether you are certified or not. But ultimately, for the growth, as Meenal ma'am also said, that for the future career perspective, you should be CPC certified. That is why you have to try for this. But ultimately, we brought opportunity to all, whether you are certified, non-certified. But certified student have more opportunity. It compares 100 opportunities. So almost 60 plus opportunities are for the certified and less for non-certified. That is the case. We provide opportunity. Yeah. Getting my answer? Yeah.
येस येस सर. सर मला ते समजलं नाही की हे ओपन बुक एक्झाम आहे ना.
बरोबर.
बट तिथं एक्झाम सेंटरला गेल्यानंतर ना तिथं आपल्यावर 3 ऑब्झर्वेशन असतं ना, कॅमेरे पण असतात. मग ते आपण कसं हे करणार म्हणजे
येस, आय अंडरस्टूड युअर क्वेश्चन. बेसिकली कसं आहे ना, ही ओपन बुक जरी एक्झाम असेल तरी CPC ची बुक छोटी नसते. इट इज अराउंड 1300 पेजेस. ओके, आणि त्यामध्ये डिफरंट कोड्स आहेत सिस्टीम वाईज. ठीक आहे, तर तुम्हाला एक ड्युरेशन दिले असते. त्या ड्युरेशन मध्ये तुम्हाला ते कोड असाइन करायचे असतात. तुम्हाला जरी ते कोड कुठे आहेत, कोणत्या पेज मध्ये आहेत, कोणत्या सिस्टीमच्या रिलेटेड आहेत, त्याचा सब कोड कोणता आहे, हे तुम्ही लर्निंग केल्यावरतीच तुम्हाला समजेल. तर तुम्ही ते बुक त्याच्यासाठीच आहे ना, रेफरन्ससाठी. एनी वन कांट लाईक रिमेंबर ऑल कोर्स एका टाइमला, ते अशक्य आहे. सो दॅट इज वाय इट इज ओपन बुक एक्झाम. सो इट इज लाईक गुड टू यू की तुमच्याकडे बुक असते, तुम्ही रेफर करू शकता कोणत्या सिस्टीम. बट जर तुम्हाला प्रॉपर गायडन्स असेल, ज्यामध्ये आम्ही कोर्समध्ये तुमचे डिफरंट टेस्ट घेतो, मॉक टेस्ट घेतो, आणि त्यामध्ये प्रत्येक सिस्टीमवरती एक युनिट टेस्ट पण असते, त्यामध्ये तुमची पूर्णपणे एक्सरसाइज होते आणि ते तुम्हाला हेल्पफुल राहते. टाइम मॅनेजमेंट, कोणता क्वेश्चन किती टाइम मध्ये तुम्ही सॉल्व्ह करायचा आहे, त्यानंतर स्किल्स, नॉलेज कोणतं लागतं, ऍक्च्युअली फोकसिंग ऑन द सिलेबस ओनली. ओके, सर त्यामुळे तुम्ही ते ओपन बुक जरी एक्झाम असेल तरी पण ते कोड सर्च करायला तुम्हाला टाइम लागतो. इफ यू डोंट नो, यू कॅन फाइंड द कोड. ओके, सो यू नीड टू नो द डिक्शनरी फर्स्ट अँड देन अप्लाय फॉर द एक्झाम. गॉट इट?
येस.
आणि पूजा, हा, त्यामध्ये बुक्स पण 3 टाईप्सच्या बुक्स असतात. CPT बुक, ICD बुक आणि हिप्पिक बुक. ओके, सो ते ॲज सर सेड की इट्स डिपेंड अपॉन दिस system. Okay, so you have to go through each code. You should know how you can go through that code. There will be a index, tabular index. Okay, so accordingly we have to go and you have to check the codes. No one knows all codes. If you are 20 years so experience you have, so कोणालाही सगळे codes माहित नसतात. It's too difficult to understand. There are lakhs of codes over there in CPT. Okay.
ओके मॅम.
सर फार्माकोविजिलेंस का एग्जैक्ट चीज क्या है?
What is your question?
सर फार्माकोविजिलेंस एंड क्लिनिकल ट्रायल.
Pharmacovigilance and medical coding, you are asking both difference. Can you ask your question? Repeat.
Sir,
Please.
duration of exam.
It is,
CPC exam.
yeah. It is 4 hours, I think, if I'm not wrong. 4
Yeah,
hours.
it will be, yes.
400 MCQ question, no?
100 MCQs.
Sir, if we didn't qualify this exam or we didn't apply for this exam, thus we are called then non-certified coder, right?
Yes.
So if by any chance we didn't qualify this exam, so is there like good job or good future for non-certified coder?
Yeah, there is a good job, but like you have to let us assume that you are certified and then you start the job. So your salary is good. Okay, the company is also, like most MNC company, preferred certified. So that is why you join, and after that the growth will be good as you are certified and other benefits you will get. But in case of the non-certified, you will get good opportunity, no doubt, but it takes a time. Okay, means you join for the less package first of all. Secondly, the companies as well, mid-level or a small level organization, and then next is you have to appear for the exam if you want to get good career in further. Okay, आपको बाद में तो उसके लिए अप्लाई करके उसको क्वालिफाई करना पड़ेगा अगर आपको लॉन्ग टर्म अच्छी करियर चाहिए तो. आप शुरुआत में एज ए नॉन सर्टिफाइड यू कैन ज्वाइन, बट अल्टीमेटली समवेयर यू हैव टू मैनेज विद द पैकेजेस एंड द कंपनी. ओके, बट फॉर द लॉन्ग टर्म अगर हम ये देखेंगे कि आप CPC बाद में प्रिपेयर करते हो, एग्जाम देते हो, क्वालिफाई करते हो, बाकी डिफरेंट सर्टिफिकेशंस भी है, देन द योर फ्यूचर विल बी गुड. बट यू हैव टू समवेयर अभी आप कीजिए, दैट विल बी द बेटर rather than after getting job and then prepare, right?
ओके, मतलब हम ऐसा कर सकते हैं कि फॉर नाउ अगर हम नॉन सर्टिफाइड कोडर के तरह हम अप्लाई कर सकते हैं, एंड देन रिगार्डिंग अगर हमें ऐसा लगा आगे, देन हम कभी भी ये एग्जाम दे सकते हैं? लाइक देयर इज नो ऐसा ड्यूरेशन कि अभी ही देना चाहिए?
No.
Okay.
There is no any duration. You can give any time. Yes.
Thank you, sir.
Yes, any other questions?
Which I think you want to ask anything. Okay, please ask your queries.
सर सीपीसी सिर्फ वो कोर्स कराते हैं या सिर्फ एग्जाम होता है उनका?
सीपीसी एग्जाम होती है, ठीक है। सीपीसी एग्जाम एपीसी कंडक्ट करती है, ठीक है। तो इसका सिलेबस ऑलरेडी उन्होंने पब्लिश किया है, तो उसके अकॉर्डिंगली आपको प्रिपेयर करना है। देयर इज नो एनी ट्रेनिंग फ्रॉम सीपीसी इटसेल्फ, सॉरी एपीसी।
सर जैसे अभी मेरी एक करंट सीनियर थी जिनका अभी प्लेसमेंट हुआ था पैसिफिक हेल्थ केयर नोएडा में, तो सर वो बिना ही सर्टिफिकेट के मतलब वो जॉब कर रहे हैं।
यस, एज ए नॉन सर्टिफाइड वो ज्वाइन किए होंगे ना?
यस सर, वो कॉलेज में सर प्लेसमेंट हुआ था उनका।
Great. Yes. So as I say ना, अपॉर्चुनिटी होती है बट कम अपॉर्चुनिटी होती है। इवन द पैकेज भी अगर देखेंगे तो थोड़ा डिफरेंस होता है उस चीज में। एंड सीपीसी करने के बाद क्या है ना, आप मेंबर बनते हैं एपीसी के, तो जो भी कोड इंट्रोड्यूस होंगे, जो आगे फ्यूचर में या कोई अपडेट होगा, इनके कोई प्रोग्राम्स होंगे, तो आपको इनवाइट किया जाता है, आप उसमें पार्टिसिपेट कर सकते हैं, तो आप अपडेट रहते हैं, ठीक है। एंड इफ यू आर नॉन, देन उसको फिर आपको अपडेट करना होता है, मतलब यू हैव टू बी ईगरली।
साल जॉब कर ले और उसके बाद सर ये एग्जाम दे देते कोई?
बाद में एग्जाम दे सकते हैं, नॉट एन इश्यू। सी अभी आप जो नॉन सर्टिफाइड है, आप वो ज्वाइन नॉन सर्टिफाइड के बेसिस पे ज्वाइन कर सकते हैं, और बाद में भी दे सकते हैं एज ए शेयर लियर, ठीक है, तो वो भी कर सकते हैं। बट अभी क्या है ना कि एज ए मेडिकल कोडिंग इज ग्रोइंग, ओके, सो इंडस्ट्री वांट अस ट्रेन्ड पर्सन। तो ट्रेन कौन होता है? जिनको ऑलरेडी सीपीसी ये नॉलेज होती है, कोड असाइन कैसे करने, ये सारी इंफॉर्मेशन आपको होती है। कब सर्टिफाइड होते हैं तो आप ऑटोमेटिकली यू नो where is the code, how many like systems are there, how to assign codes like। तो इसी के लिए ये एग्जाम जरूरी है, जो इंडस्ट्री इसके लिए चाहते हैं, क्योंकि देयर इज नो एनी ऑन जॉब ट्रेनिंग वगैरह, ये सिस्टम कम रहती है ऑर्गेनाइजेशंस में। तो ज्वाइन करना आसान रहता है इफ यू आर क्वालिफाइड। अदरवाइज नॉन क्वालिफाइड, नॉन सर्टिफाइड के बाद आपको फिर से प्रिपेयर करना पड़ेगा, ठीक है। अगर आपको इमीडिएटली ज्वाइन करना है, यू नीड जॉब की रिक्वायरमेंट है, तो आप नॉन सर्टिफाइड ज्वाइन कीजिए और फिर सीपीसी के लिए प्रिपेयर कीजिए, ये भी हो सकता है। अगर आपके पास समय है तो गिव दैट टाइम फॉर द सीपीसी प्रिपरेशन, प्रॉपर्ली प्रिपेयर एंड देन क्रैक एंड देन ज्वाइन, ये भी हो सकता है।
यस सर।
How we get that book? CPT, ICD, and HCPCS.
Yes. So basically we given you the books in soft copy and hard copy both। तो जो सीपीटी की बुक होगी, जो डिक्शनरी होगी, ओके, वो हम आपको हार्ड कॉपी डिलीवर करेंगे आपके एड्रेस पे विद ऑल यूनिट टेस्ट एंड मॉक टेस्ट, जो टेस्ट रहेंगे वो। रेस्ट ऑफ द थिंग्स जैसे लैंग्वेज ऑफ मेडिसिन से या आईसीडी की बुक है, वो हम सॉफ्ट कॉपी प्रोवाइड करेंगे।
तो सर जो आप बुक दो मतलब देंगे सर, वो हम उसी से एग्जाम क्वालिफाई कर सकते हैं?
यस, वो अपडेटेड ही बुक रहेगी सीपीटी।
तो सर वो बुक हम एग्जाम में लेकर जा सकते हैं?
यस, बट देयर एग्जाम में आपको एडिशनली प्रोवाइड की जाती है, लेके जा सकते हैं, बट वहां पे भी आपको बुक्स दी जाती है।
अच्छा, सर जहाँ पे एग्जाम होता है वो लोग बुक खुद देते हैं?
यस यस
यस, थैंक यू।
Sir, D pharma eligible or not?
Yes, what you ask?
Sir, D pharma eligible or not?
D farm has very less opening as per our experience, काफी कम opening होती है D farm के लिए। So like but still like जो small scale organization वहाँ पे apply कर सकते हैं, but जैसे मेरा सजेशन रहेगा, आप D farm and CPC qualified ऐसा होता है तो एक चांस बन सकता है, but only on the basis of D farm they are very hard to get job.
Okay, sir.
हेलो हेलो
Yes, please ask.
सर, आपने बोला कि सीपीसी का एग्जाम 60,000 के ऊपर है इसका रेट, लेकिन मेरे एक फ्रेंड ने हैदराबाद से कंप्लीट किया जस्ट पिछले मंथ में, तो उसने शायद 50,000 में 2 चांस मिला था उसको और वो पास हो गया, मतलब 50,000 ही लिए थे उसको क्लास वाले ने। हैदराबाद में क्लास था।
50,000 कोर्स की मैंने वही बताया ना कि जो कोर्स दो होते हैं इसमें, एक तो मेंबरशिप होती है एपीसी की और एक एग्जाम की होती है। तो एग्जाम की 50,000 हो सकती है, 15,000 15,000 जो है वो एपीसी की मेंबरशिप है जो आपको लेनी पड़ती है शुरुआत में, उसके बाद ही आपको वाउचर
मेंबरशिप प्लस एग्जाम दोनों दिया था, मतलब 50,000 में, और एक्स्ट्रा कुछ नहीं दिया था।
ओके। तो मैं तो अभी अपडेट बता रहा हूँ, आई डोंट नो अभी फिर से आप एक बार चेक एपीसी पे चेक कर सकते हैं। इट इज नॉट लाइक एपीसी में जाएंगे ना तो आप वहां पे इंफॉर्मेशन दे सकते हैं सीपीसी, तो यू कैन गेट अपडेट वो डॉलर में।
यहाँ से हैदराबाद था ना वो कोर्स, तो वो जो 4 क्लासेस था वो एपीसी सर्टिफाइड था, तो उसको मतलब क्लासेस की तरफ से डिस्काउंट था, 50,000 में करके दे रहे थे उन लोग। टाई अप था एपीसी से और अहिमा से क्लासेस का।
ओके यस मे बी ये हो सकता है, इसके लिए हुआ होगा, राइट। तो ये इन केस में हो सकता है अगर रजिस्टर्ड वो अलग, अगर कोलैबोरेशन में है एपीसी के तो। बट यस, थैंक्स फॉर शेयरिंग दिस। Any other question? Yes, anyone want to ask anything to Minal ma'am?
हेलो सर।
Yes, you're audible.
Yes,
Yeah.
you're audible. ये ओपन बुक टेस्ट है, फिर भी क्वालिफाई करना इतना मुश्किल क्यों होता है?
Minal ma'am, can you answer?
Yeah. See, open book test भी है तो आज मैंने बोला कि more than 50,000 CPT course है. Okay, to get accurate code is very important. You will get many MCQs, options will be there. And ऐसे कभी नहीं होता कि एक ही कोड है CPT. अगर सर्जरी परफॉर्म हुई है तो there will be 2 to 5 CPTs will be there. सो 5 सीपीटी आपको सर्च करनी है, वो भी एक्यूरेट सीपीटी सर्च करनी है। विद दैट आपको मॉडिफायर्स भी देखना है, देन यू हैव टू गो फॉर आईसीडी आल्सो। ओके, सो मॉडिफायर्स एंड इफ यू लर्न ऑल दोस थिंग्स यू विल गेट टू नो कि अगर ओपन बुक भी टेस्ट है फिर भी हम क्वालिफाई क्यों नहीं कर पाते, बिकॉज देयर विल बी एवरीथिंग, सो एवरीथिंग यू हैव टू टेक केयर एंड यू हैव टू गिव द एक्यूरेट कोड। सो कभी कभी ऐसे होता है 4 घंटे भी कम पड़ जाते हैं टू गो थ्रू ऑल द क्वेश्चंस। ओके, अंडरस्टूड?
यस मैम।
एनीवन वांट्स टू आस्क एनीथिंग?
मैम जैसे हमारा एचएपी ह्यूमन एनाटॉमी एंड फिजियोलॉजी स्ट्रांग होना चाहिए, मतलब मेडिकल कोडर फील्ड के लिए।
बराबर।
तो मैम जैसे हम लोग अभी तक जो भी पढ़े हैं, जैसे मैं भी बैचलर ऑफ फार्मेसी कर रहा हूँ, तो उसमें हमारा मतलब सेमेस्टर तो छोटा ही होता है, पर जैसे हमने पढ़ा है तो उतना काफी है या हमें और डीपली पढ़ना पड़ता है मैम?
अभी कैसे होता है, आपने जो पढ़ा है वो एनाटॉमी पढ़ा है, राइट? अभी डॉक्टर जो है वो सर्जरी परफॉर्म करते हैं, तो सर्जरी जैसे परफॉर्म करते हैं यू हैव टू गो थ्रू दिस वेन टू दैट वेन। ओके, जो इंस्ट्रूमेंट यूज होते हैं, ऑल द थिंग्स, और ये सब जानने के बावजूद भी आपको देखना है वो सीपीटी कोड कौन सा प्रेफरेबल है, एक्यूरेट है, जो भी हमने परफॉर्म किया है उसके लिए। ओके, सो हमें सिर्फ एनाटॉमी नॉलेज ही पता होता है, हमें डीपली उसका प्रोसीजर क्या कंडक्ट किया है। अभी सपोज किसी ने सीटी स्कैन किया है तो उसमें भी सीटी ए है, सीटी है, उसके बाद कभी कभी ड्यूप्लेक्स परफॉर्म होते हैं। ओके, फिर वेन्स के लिए कुछ स्टडीज परफॉर्मेंस होती है कि एमआरए है, एमआरआई है, तो एमआरए के लिए हम क्या सिनोनिम्स देखेंगे मेडिकल कोडिंग में, मेडिकल रिपोर्ट्स में, और हम एमआरए कंसिडर करेंगे। और कुछ नहीं है, कुछ ऐसे वर्ड्स होते हैं जो हम रीड कर पाते हैं और वी कैन एनालाइज वेदर इट इज एमआरए और एमआरआई। ओके, सो वो डिफरेंस हमें कैसे फाइंड आउट करना है, मेडिकल रिकॉर्ड रीड करके, तो वो सब हमें समझ में आता है। देयर आर मेनी मेनी थिंग्स दैट यू कैन लर्न इन दिस। सो इट्स नॉट लाइक दैट वी नो एनाटॉमी, बट हाउ वी आर कंडक्टिंग दैट प्रोसीजर इट्स important over there. Obviously your anatomy knowledge will work over.
Yes, thank you.
Mhm. Anyone have any doubt?
Yes, any other questions? Yes, students, any other question?
Okay,
Okay.
so request Minal ma'am, can you share any last tip for all the students, as most of the students are fresher for medical, getting job in the medical coding? Any advice you want to give?
Yeah, my suggestion is like that if you are going to the certification, right, you'll get more chances to get a job. So when I started, there are many chances that company is providing the certification, but now no one is doing that things. And if you are gaining experience also, suppose you have worked as a non-certified and you have 1 year or 2 years experience in medical coding, but at the end, the company will ask you for a certification. If they are getting certified coder, so an experienced coder who is non-certified. So obviously over non-certified or experienced, they will conduct a certified coder. Because you know from the US side or a client side, they always want certified coder. They will charge their company according how many certified coders they have. So my suggestion is always go with the certification because what things will happen, you know, if you started working, right, you will not get that much time to learn and to solve the mock test if you are working over there. So if you start doing it from now, it will be beneficial for you as well. Because later, if you gain the experience with a certification, you'll also understand that specialty or that work in better way if you're working as a non-certified one. And always there will be a more value for certified coder. So that's it from my side. Okay.